Well, good late morning, lunch, early afternoon. I'm not sure what time frame we're in right now. I want to first off thank you all for being here. My name is John Caspel. I'm an assistant chief here with the police department. I'm assigned to our field services bureau. And first thing I'd like to do is just, again, say thank you all for being here. It's interesting trying to line up some sort of a kickoff like this that's citywide, that's countywide, to get all these community partners in the same room together, because calendars are full. Everybody's busy in the morning. Everybody's got schedules all afternoon. But everybody's got to eat, so the best way to get everybody together, let's serve some lunch and have everybody here. So, so again, thank you all for being here. It really does mean a lot. We're here to officially kick off the Lubbock Police Department's Mental Health Peace Officer Program. This is something that has been in the works for quite a while, and I'm very pleased to announce to everybody that our plan has actually been going now for about the past 6 weeks, and today we're doing our hard rollout to make sure that our community partners and the public understands what it is that we are doing. You know, one of our command staff folks here has a quote that makes him cringe. And that quote is, well, we're just going to keep doing it because that's the way we've always done it. I think we in law enforcement have gotten stuck in so many ways with that quote, and I can tell you that we no longer adhere to that. And part of what you're going to hear about here in the next about 10-15 minutes is we're changing the way we do things here at the Lubbock Police Department for the betterment of our community, and I think you all will see that and appreciate that. Before I roll into my talking points, I think we need to recognize some folks that are here. Mayor Pope, if you would give us a wave real quick. Thank you for being here. I saw from our City Council, Latrell Joy, Sheila Patterson-Harris, Steve Massingale were here. Thank you all for being here. Our City Manager, Jared Atkinson, is here. We had us a little bit of a win this week, didn't we, with quite a snow event. So everybody teamed up very, very nicely. Chad Weaver from the City Attorney is here. I saw representatives from the City Secretary's office. Thank you all for being here. Catherine Wells from City Health, Director of City Health, is here. Drew Farmer, I saw Drew here. Welcome. Beth Lawson, CEO from Star Care, and a lot of her folks are here. Thank you for being here. From Lubbock County, I saw Johnny Jaquist, Chiefs Howell, and Chief Scott, and you brought several of your folks. Thank you all for being here. From the District Attorney's Office, Sunshine Stanek and some of her folks are here. Thank you all for being here. Dr. Andy Young from Lubbock Christian University is here. Keno McWinney, Texas Tech Department of Psychiatry. That's right. Mental health. They're very good. We have representatives from Lubbock Fire Rescue, executive and command staff from the Lubbock Police Department. If I've missed somebody, please forgive me. And our media, thank you all for being here. I think it's very important to do something like this in a very public way to make sure that our community understands what it is that we're doing for them. The last person that I'm going to acknowledge is Chief Stevens is here. And I save him for last purposefully because I'm going to brag on him just a little bit. When he became our chief, one of the very first things that he changed in our culture was how we do business. We brought in community-oriented policing. And he'll be the first to tell you that that's a very simple phrase. It has a lot of different meanings out there, but just break those words down. We're orienting our policing to the community, and that's what this program really is. He's going to come up and speak here in just a little bit, but he has been very open to changing the way that we do things. We noticed that with our homeless outreach team, and when it came to how we try to do things better in serving our community when it comes to responding to mental health and behavioral health crisis calls, he's been very instrumental in giving us free rein to go out and create a program that works and will work very well for our community. I don't think that anyone in this room would disagree with this statement that Lubbock is experiencing a mental health crisis. There are so many of us in this room that deal with a growing mental health population here in Lubbock, but we've all been doing it on our own individual silos. I know Lubbock County has, Star Care has, we have, the DA's office has, specifically in county, the jail population is dealing with this. Lubbock Fire Rescue and EMS, because they respond to medical calls. Our city elected leaders get inquiries about these types of persons. So we are experiencing a mental health crisis here, and it's, I believe, our job, and us in the police department, we need to find a way to respond to these more effectively. Too many people in jails not getting long-term help. From a law enforcement standpoint, you know, in the past it's been so easy for police officers to put themselves in our own silo, our own box, and say, you know, this is a criminal matter. I'm going to find a nuisance crime. We're going to put that person in jail. They go to jail. They'll spend a little time there. They may get a little treatment. They're right back out on the streets again, and there's that revolving door. And we're not serving our community well by doing that. We're not helping the people that are experiencing mental and behavioral health crisis to help this to subside. And so we're looking for a different way of doing that. Why the police department is really stepping up and trying to not just be at the table when it comes to community-wide solutions, but really try to be more at the head of the table, is because we are the first responders that go to this. When someone is in mental or behavioral health crisis mode, they're going to call 911. Their family's going to call 911. The community is going to call 911. And your police department, your police officers are the ones that are going to respond to it. We are no longer just law enforcers. We are public servants. And so we have to find which hat we have to put on in dealing with these folks and what's the best way to deal with them. So it's very appropriate for your police department to be at the forefront of mental health response calls for our community. So we're here to introduce the Mental Health Peace Officer Program for the Lubbock Police Department. It consists of two main parts. The first is our mental health peace officers. Now, several years ago, our state legislature had the wisdom to create a state certification for mental health peace officers. It is advanced training and certification for any peace officer. And what it does is it arms them with a statewide curriculum on basic recognition of symptoms and maybe some diagnosis and de-escalation and how to deal with people that are in obvious mental and behavioral health crisis. In allowing police departments to certify mental health peace officers, that gives us the inroads to further that training and to build programs like this. So we have a mental health peace officer program. It's been small. We've had one for quite a while. It hasn't been as robust as we're about to make it. So it dramatically increases the training and the expertise of our department. Currently, we have around ballpark 30 officers that are mental health peace officers. I'm one. Medium and long term, what we want to do is dramatically increase the training for our mental health peace officer numbers. Any studies that we have done says that about a third of your patrol divisions need to be mental health peace officers. Now, what that's going to do, having that dramatic of a number, is going to make sure that regardless of the day of the week, the time of the day, it could be Christmas morning, if our officers respond to someone that's in mental or behavioral health crisis, they're going to be able to call for a mental health peace officer. There will be one on duty that can respond with their level of expertise, de-escalation tactics, their level of training to help intervene with that situation. So we are really building up and trying to make our mental health peace officer certifications so much more robust. The second part of our mental health peace officer program, and this is really the cool part, is a crisis intervention team, full-time crisis intervention team. So many of you have seen that it's an acronym CIT. You've seen that throughout the country. You've seen it all throughout Texas. The Lubbock Police Department finally has a CIT. It is a full-time unit that is modeled after our homeless outreach team, and it has two main functions, reactive and proactive. The reactive part of our CIT is that they are going to work roughly 1 p.m. To 1 a.m., and they are going to respond to calls for service. They are an additional layer of call response in addition to our mental health peace officers, and these are very, very specially trained, hand-selected officers as part of the CIT that can go and respond on these calls for service. The really cool thing that they're going to do, and this is really the game changer for the community of Lubbock, is the proactive part of this. They're going to actually be working cases. They're doing case management and case referral. So they are building a database of known clients within Lubbock that they can go and revisit after the fact. This is new to the police department. We've done this on a criminal side, but not on a mental health side. So imagine a program where we have CIT members that when call load will allow them, will go back to their Rolodex, their database, and say, okay, who have I not visited with in quite a while? I've got this person here. It shows that we interacted with them about a week ago. I'm going to go by and check on them. And so they can go out and be proactive and see what their living conditions are, if they're getting enough food, if they're hydrating, if they're taking their medication, if they need a ride to a doctor's office or to go see their mental health care practitioner, to intervene with them on a positive scale, proactively, before a mental or behavioral health crisis situation hits. So think about what that can mean for our community and for officer safety and for public safety. You know, if we can intervene with someone that has a clinical diagnosis and do that in advance before they hit a crisis point, our officers may never respond on that, and it's all because our CIT members have gone and intervened with them and built those bridges with them in advance, and that's a real game changer for us. So what I'm going to do now is I'm going to call up our full-time CIT members and a few additional folks. The commander over the unit is going to be Lieutenant Misty Snodgrass. You can come up, stand up here, please. I know you hate this part, but you're going to come do it. Sergeant Steve Bergen is going to be the field sergeant. He is also in charge of our homeless outreach team. I've asked him to also serve as the first line supervisor for CIT. He's been very instrumental in these types of issues for a long time for us. Officers Kimberly Crane, John Wilhelm, y'all please come up as well. These two are the ones, and you'll hear about it a little bit more, this was their idea. They're the ones who said, we have a problem here in Lubbock, and here's our solution. And they have been very instrumental in getting this all together. I'm also going to ask Officer Thomas Thompson to come up. He's not a member of the team yet. We've tabbed him to be a third member when manpower allows, but he has continued on his own to be a very instrumental part of this team. I'd also like to call up Dr. Andy Young and Captain Nathan White. Both of them are not members of the team per se. They are contributors to the team. This team was a vision of Captain White's for a very long time, and he's a contributor to this team. And Dr. Young has been a mental health partner for the Lubbock Police Department for many years. He and I went through many years of crisis negotiations, hostage negotiations together. Dr. Young, I brag on him, and basically he's our police psychologist. He is just an invaluable member of the Lubbock Police Department. For all intents and purposes, ladies and gentlemen, this is your crisis intervention team. They're a game changer for how we respond to mental health, behavioral health crises in Lubbock, and I ask that you please thank them for their time. So just very briefly, let me tell you what they are not. They are not going to be a substitute for criminal prosecutions, for criminal situations or arrest, okay? They are still cops, and they're going to be cops. They're going to put public safety first, okay? So just because they respond to a call doesn't mean that there won't be an arrest, doesn't mean that someone may not hit the jailhouse, or that a criminal investigation is not going to ensue. That certainly may. There are codes of criminal procedures, laws, procedures that they will follow, and if a law has been broken, they will be expected to enforce that law. They're not clinicians. They're not going to be able to respond and diagnose somebody and prescribe medicine and get them into treatment, things like that. But what they are is a very effective tool for how we respond to somebody long term. They're very well trained in de-escalation. What we really think we're going to see with their continued bridge building with our community is somewhat of a reduction of use of force. Okay. Now you think about if someone is out there, let's say they're in a behavioral mental health crisis and they have a knife, and they're wanting to hurt somebody or hurt themselves. You know, if a regular officer shows up, they certainly might be able to disarm them. They may not be able to. These people have the expertise to really talk to this person and try and de-escalate that situation. So that's a really big deal in trying to reduce what may be levels of use of force we may have to use. But also what they're going to do is they're going to, I believe, dramatically improve the quality of life of our community by being able to positively intervene with those in the community that experience mental and behavioral health crisis, to know that when something happens, to see one of these officers show up that they have intervened with time and time again, it builds that level of trust, and that can help de-escalate a situation simply because they know that these are the people that are responding and they can trust. This is the team for now. What we want to do at some point is expand it. We would like to have volunteers. We would like to have clinicians part of the team. Andy Young is part of our victim services. We're going to be using his volunteers to eventually get to more of a co-responder model. And some of you that have seen CITs before know that a co-responder model means that there would be a clinician or a well-trained volunteer that's riding with our folks to respond to calls for service. And think about what a force multiplier that could be when you have an officer there that is a CIT member, as well as a civilian that is certified and trained that can go and help and get these people into services. That does nothing but just improve our community as a whole. So the face of law enforcement dealing with mental and behavioral health crises is changing. And the Lubbock Police Department is changing along with that. I would dare say, thanks to the leadership of Chief Stevens and these folks, we're going to take the lead in that in this community and make a real difference here. Being proactive means we're going to be effective. And so we're going to do this right. We're going to need a lot of help from the community. We need to get the word out about what this team is and what they're going to do and how this is going to be a game changer for the community of Lubbock. And so we're asking you all to do that. Make sure you utilize these folks. They will be here afterwards if anyone would like to come and talk to them, ask questions. They've got documentation pamphlets that they'll be handing out on all their calls. They will be available to y'all. So let's utilize them for the betterment of our community. So at this point, what I'm going to do is I'm going to open it up for some comments. I believe Beth Lawson asked if she would, to be honest, I asked her, but if she would come up and maybe say a few words. I believe Chief Stevens as well, and Mayor Pope, just to come up very quickly and say just a few brief words at this kickoff. So.
Thank you very much. In thinking about what I would say today, there's just so many different avenues I could take, but I think I'll just start with thank you. Thank you to Chief Stevens. Thank you to the City Council. Thank you to Mayor Pope. Having a community that supports people that are different than us is a mark of a good community. And what I will tell you is we are here to provide support to our citizens, and that's all citizens. What we're talking about today is not a get-out-of-jail-free card. This is not a bleeding heart, oh, people with mental illness shouldn't be held accountable. This is all about public safety and the safety of all of our citizens, your neighbors, your children, your mother, and me. It's about helping people get access to the health care they need. We know that there are times people who have diabetes or heart issues also may have some intersections with the criminal justice system. Their heart issues are dealt with, and then their criminal justice issues are dealt with. The same goes for mental illness. But what we know in a public safety venue is that getting people access to the care they need in the right setting is much more economical for our citizens and much more humane for our people and for our family members. We know that in Texas and in the nation as a whole, criminal justice has become the #1 access point for mental health care. We can do better. We know that in Texas, the biggest psychiatric facility is the Harris County Jail. Quickly, the Lubbock County Detention Center is becoming the #1 hospital or the gateway to the hospital for mental health services. That's not a reflection on Lubbock, Lubbock County, the city of Lubbock, or the Lubbock citizens. That's a reflection of our nation and the deinstitutionalization that started in the 60s. We are here as Star Care, as the professionals to provide mental health treatment to people in need. We can't serve everywhere, or everyone. We can't be everywhere. I really love the term force multiplier. Having interactions with veterans and LPD and the sheriff's office, I kind of now am a self-appointed peace officer. I really will tell you that the eyes and the ears, the more we have, the access to the team like we have here with the homeless outreach team, and we have the mental health peace officers program and the CIT, that will do nothing but save Lubbock heartache, it will save citizens heartache, and it will save our citizens money. It always gets to money, folks, and you know it as well as I do. Sometimes the right thing to do really is the cheapest and the most economical thing to do. And so when we start talking about co-response, I'll end my thankfulness and my rambling with a commitment. Star Care is a governmental entity. We are not a fly-by-night. We are for the people. We are here by the people. We're appointed by the city, the Lubbock, and the county and the school district. We are professionals in this realm. We let City Bus provide transportation. We let the police deal with bad guys. We let the sheriff deal with the county. We let the detention center staff do what they do best. Let's keep mental health where it needs to be, and let's keep it in a place where people can actually get better and become citizens that are productive. But what I'm going to commit to this group here today, and then also particularly to the police department, is I have access to looking for funding that can allow us to co-respond. And what you see here, I have a mirror image right over here. Bobby, would you please stand? Sarah, will you please stand? These are the directors of our forensics and our crisis mobile outreach team. And so these folks are the mirror image, the clinicians that Chief Caswell talked about, in that they provide the clinical approach, you provide the law enforcement and the peacekeeping. And what I commit to you is helping find funding so we can co-respond. Thank you. And I can't tell you what a big day this is in Lubbock, Texas. As our mayor says, it's a great day in Lubbock, Texas.
Thank you, Ben.
I just wanted to say real quick a couple of things. Really, first of all, I want to give credit where credit's due. While I appreciate the the accolades, I say some funny things, make people laugh. It's one of my favorite things to do. But as my wife will tell you, I'm not very funny at all. I just quote a lot of movie lines, and that works pretty well for me. I don't have a lot of original thought there. And the same holds true for things like this. Not a lot of the ideas and the good stuff we've accomplished have been my original thoughts. Probably 3 years ago, I was faced with a big issue with homelessness and homeless issues across the city, and I was trying to come up with some good solutions and things to do. And Steve Bergen came by the office and said, "Hey, you got a minute?" It's something I'm used to. It's "Hey, you got a minute? Hey, you got a minute? Hey, you got a minute?" And if nothing else, I hope to be remembered for approachable and for someone who says, "You bet, come on in." And what I've really tried to do well is to know when there's a good idea, to know when ideas need a little bit more work, but also to know when, how to tactfully tell someone that's a terrible idea, go back to work and come up with something good. And Sergeant Bergen had an awesome idea, and we sat and we talked about that, and from that came the homeless outreach team. And when we worked through that, and the next steps were, hey, start picking your people because I'm ready to move if you are. And at the time, he was a detective, a corporal in our homicide unit, and I told him, I said, "Hey, listen, you got the most desirable job in the PD. You sure you want to go back out into the streets, work at night?" And he goes, "I'm ready." That's why I came and brought you the idea, and so that was born from that. Mental health is a big issue. Law enforcement is on the front lines of that, and most officers, me included, the average police officer is very ill-equipped to deal with what kind of mental health issues face our nation, and it's certainly something that is at the front steps in Lubbock, Texas. And so, as I've struggled with that issue for several months now, working with Beth Lawson and working with other entities across the city, Lieutenant Snodgrass came by and said, "Hey, you got a minute?" I said, "Yeah, you bet." And she brought two of these fine folks, Wilhelm and Crane, by the office, and we met. And they pitched this idea of the CIT, and we had already been up and had the robust mental health peace officer program going, and it was working well, doing awesome stuff, and I knew we were going to have to commit resources to a full-time team. But from that, I looked at both of those officers and I said, "Well, how serious are you?" Because they were in choice assignments, working day shift and working at our academy, doing an awesome job out there, and they said, "I'm ready. We're committed to the program." And so here we are, and we started that just a few weeks ago, and now I'm excited to say this big launch. And I say all that to tell you that, man, I really appreciate when people come across and say, "Hey, Chief, you're doing a great job. Everything's good, but I tell you, I'm not the one out there dealing with mental health issues in our community. I'm not the one on the front line of that. I don't day in and day out like these two gentlemen here, these two officers, and have to face head on the homelessness issue in Lubbock, Texas, like these officers are doing, and like Andy Young is having to deal with, face to face the mental health crisis that's in our community. And so while I appreciate those comments, that's not me. That's these folks here that you're looking at that are doing that. And so that's an awesome job. It's a good idea, and it's going to grow from here. As the department grows, we'll commit more and more resources to it. And so I can't thank these folks enough for what they're doing. And so, with that, I'd also be remiss if I didn't say how much I appreciate the support we get from city management and from our elected officials. That we're a growing city. I think growing faster than most anywhere else in the nation. And so with that comes big city problems that if we don't not just face head on, but get ahead of and stay ahead of, that's how we remain one of the very best places across the nation to live, to work, to play, to visit, and so that's what we do. And I'll close out with this, that the Lubbock Police Department is tough on crime. That's what we do. We face crime head on. But what this program does is make sure that we are able to deal with things that aren't truly criminal in nature. And a lot of the problems, a lot of calls police officers go to, they are rooted from mental health, not from criminal conduct. And so the more that we can free up the everyday police officer and have these officers deal with mental health issues, the more that the officer you see driving by in the black and white, the more that guy or gal can hit crime head on and be tough on crime like you expect your police officers to be. That's a win for all of us. So I appreciate everything, John. Go ahead.
Good afternoon. It's great to be here today. I appreciate just a minute to share a couple ideas. First of all, last night we opened up Santaland, and I was joined by several members of the council, and I forgot to introduce them. So I want to, even though they've been introduced, I want to make sure that I thank Mr. Maskill, Ms. Joy, Ms. Passion Harris for being here today. And together I know I can say that together we support this effort. Chief Stevens, I found in 30 years of business, particularly 20 years of my own business, that often the very best ideas came from the people closest to the customers. And so it takes that kind of leadership, and I appreciate that. Chief Caspel, thank you guys for embracing that. Thank you guys for good ideas. I've gotten to work with Bergen and what they've done with the HOT team, and homelessness never really gets very far off of our minds. It's certainly on the top of the stack. We'll announce some efforts in January to sort of redouble some of the things we're working on in that respect. But I'm excited about this effort. Mental health is a critical problem in our community. A number of us in the room were invited nearly a year ago, 9 or 10 months ago, to a meeting that then Chancellor Duncan called, and from that meeting, Star Care, Texas Tech University Health Science Center, the City of Lubbock, Lubbock County, Covenant, and UMC all have come together to fund a study, which will be done, is started, it's kicked off, and will be run. The study is being done by the Meadows Foundation, their mental health group out of Dallas, and the Community Foundation of West Texas. The Community Foundation of West Texas is helping us with that. They're sort of Switzerland for this deal. They could collect the money if we all kicked in money to fund this, and they're going to be they're the responsible party, of the ones that have hired the Meadows to come in and do the work. And in the meantime, Texas Tech has recruited Keno McQuinney back to our community to run the Texas Tech Mental Health Institute. It's one of the 4 things that, in addition to the vet school and a dental school, and can't remember what it is in San Angelo, but the tech's going to ask the legislature for 4 things, and one of them is this mental health institute. So we're very excited about that. When we were inducting some of our famous musicians or artists into the West Texas Walk of Fame earlier this year, Josh Abbott, the Texas country singer from Idlew, was making his comments, and somewhere in the comments he quoted, he told a little story about he was asked recently or in the last several years as they were growing and enjoying some success. Somebody looked at him and said, "Why Lubbock, Texas?" And his answer was, I thought, was right on it. It was, "Why not Lubbock, Texas?" Okay? And there's not a lot of places in our community you could bring this kind of collaboration together. From the district attorney's office to representatives from the bench, from law enforcement of all sides, from the city and the county, from the mental health, from mental health. It's we can lead the way with efforts like this, and there's no reason why Lubbock, the city of Lubbock, and our partnership can't be different when it comes to solving is a big word when you say mental health, but helping solve some of these problems. You haven't lived long enough if you haven't experienced mental health with somebody you love, often under your own roof. We, as a community, need to step up on this one. So I applaud this effort, and I know that we're behind you guys, and to the degree we can support you at a council level from a policy-making standpoint, we're there. Thank you.
Thank you. We're going to wrap and close real quick. I also want to just briefly thank Tiffany Taylor and Casey Whitley, our PIOs, for helping to get the media help get the word out. They're going to be very instrumental in keeping the word about this program going. I also wanted to thank MJ Rosas and Alex Rodriguez, my lead administrative assistants. I can't do anything without these 2 girls. They run the show for me. They're the ones who helped arrange lunch and get all this done. Would you please thank them for your efforts? With that, we're going to close. If there is anyone that has any additional quick comments or questions that we can answer in this format, anyone have any questions at all? Again, I can't thank you all enough for being here. To see the community partnership in this room and to allow us to be at the forefront of this is a big deal. This is a game changer for Lubbock. Thank you all again for being here.